Generic drugs in our country and the perils of counterfeit drugs. Domestically produced generic medicines, or what we refer to as over-the-counter drugs, OTC drugs, have often come under scanner for failing quality tests. And India has been battling the challenge of substandard drugs for a while. The problem was in the spotlight when the government launched its Jan Aushadhi initiative. And now the Central Drug Standard Control Organization, or the CDSCO, has begun flagging poor quality drugs on their websites, along with sending out frequent reports and drug lists across the country. Let's take a look at this recent findings that have come to the fore. Several commonly used medicines have been flagged for failing quality tests in the latest drug safety alert issued by the country's apex health regulator. The list includes top-selling medicines such as the epilepsy drug Gabapentin, hypertension drug Telmisartan, anti-diabetes drug combination Glimepiride, and of course Metformin, and the HIV drug Ritonavir. They are all part of this drug alert. It also includes iron and folic acid tablets, probiotics, and several multivitamin pills. It also includes vitamin C, vitamin B12, folic acid, and niacinamide injections. The monthly list issued by the Central Drug Standard Control Organization on its website has 48 medicine batches failing the quality parameters in the month of March out of a total of 1,497 samples tested. It reflects a failure rate of over 3%. That's very, very high, ladies and gentlemen. These not of standard quality drugs can adversely impact the quality of treatment and cause harm to patients rather than cure them, besides contributing to the emergence of drug resistance and the spread of disease. These alerts are used by the government to see cues and conduct investigations at manufacturing units which are frequently failing quality checks. The Central Drug Standard Control Organization has now ramped up its testing ability, and also the parameters for medicines being manufactured, is flagging the renewed list of failed drugs on its website every month. The drug makers will have to now withdraw the entire batch of medicines that have been sent out for large-scale circulation. The drug regulators have and will be providing proactive information and leads to all concerned regulatory officials from time to time. Additionally, external agencies have been roped in to investigate the presence of counterfeit drugs across the country. The Ministry of Health and Family Welfare is already conducting massive nationwide audits and raids at several drug manufacturing units to fix the gaps in good manufacturing practices. Himani's got us this story. Listen into her piece, her report.
I would like to clarify here, there is nothing alarming, as this is just between the companies and the government so far, because the tests are from the batches and the batches have already been alerted and flagged to the company. Now companies will immediately recall these batches. So there is no alarm in terms of consumer. I would request that patients who are consuming these medicines, there is no panic, there is no alarm, there is no lethality involved in the medicines that you are consuming. So this is a routine practice where the government keeps doing the sample checks from the batches that are released by the companies in the market to tighten the security loops and to understand that what have been the safety procedures. And the companies that feature frequently in the failed lists are the companies where government does more of a scanner, does more of investigation and raid activities. As we know that central government is already in process of nationwide raids and investigations after several countries including Gambia, Uzbekistan and United States leveled allegations over the made in India drug products. The government has already raised its scrutiny over several drug firms. Coming back to this monthly list, in March, 48 samples have failed the quality tests. So when we talk about quality tests, this quality tests can be divided into certain parameters. So these 48 batches that we are talking about, these drugs are not of standard quality. Means that a certain benchmark that a drug should achieve, that the good manufacturing practices should have been followed, there was some lapse. It indicates that. Now what is the harm? The harm is that the outcome of the treatment gets delayed. What this kind of a drug can do is increasing the drug resistance among the patients.
On